Hello, this is Dr. Scott Harrington coming to you live from my virtual doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor virtually from most US states. Not just as a one-time consultation, but as your primary care doctor, someone who gets to know you, someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, diet and exercise and lifestyle changes will always be my first recommendation. My goal for you is to take control of your health. And through the power of healthy lifestyle, we will work to heal your chronic conditions and help you get off your chronic medications. In other announcements, we are now offering vegan primary care patients free weekly weight loss check-ins with a weight accountability visit on a private group Zoom meeting Tuesday nights, 7 p.m. Eastern Standard, 6 p.m. Central, where we will share our weight loss tips and tricks among the vegan primary care community. If you are one of my many patients interested, simply sign into the Zoom link, my virtual office address, and join the meeting. I look forward to seeing you there and sharing your success and useful tips to help all of our members succeed in their weight loss journey. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we're live streaming to multiple platforms, ready to take your questions. Hi, everyone. All right. Hello, Ria. How's it going? So I've got a few things that I made up for this session here. I'm going to go ahead and try to share my screen, and we'll kind of go over a few of these tips. Let's try it. Let's go. Let's see. Boom, 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 boom. Share. Let's try it. Here we go. Okay, here are a few tips that I wanted to go over. One of the things you'll hear is that you should be on the whole food plant-based diet, free of salt, oil, and sugar. SOS free. Okay, so today I'm going to talk about salt and sugar in particular. We know oil is a processed food that's high in fat. It's an empty calorie, and it's liquid fat, and it's bad for you in general. Let's go ahead and talk about salt and sugar. Okay. The way you have to think about salt and sugar is that they're drug-like foods. This drug-like powder is there, and it's made in a factory, and it doesn't look like something that's in nature. And what I'm trying to show here is the idea of that these foods make you eat more. They make you eat more. And not only that, they make it so that natural foods with natural levels of sugars and salts are more muted. So here's a normal picture of fruit and vegetable, fruit. And then here, this side, this is a picture of it being desaturated. So the concept is that you don't appreciate the flavors and tastes when you're constantly eating food that's really highly processed, and it can cause you to not appreciate it as much. It's hard to eat food that's not too salty or sweet because it's just not as highly addictive and highly palatable. Okay. I have this saying about salt, about when you put something in your mouth, when you pop, you can't stop. That's a saying for a reason, because when you eat a very salty food, it sits on your tongue, on the receptors, and then it gets washed away really quickly. And so it's like you're on fire. You're in a food frenzy. You can't help it. Without even thinking, the food goes into your mouth. So be careful with salt, because salt puts you in a frenzy. It makes you on fire. And then when you're on fire, you know what to do. You have to stop, drop, and roll. And then you have to reflect. So stop, put down the potato chips, or drop them, put them down, get away from the situation that's triggering you, and reflect. I know this kind of sounds a little bit, I guess a little corny or whatever, but when people have dealt with addictive eating behaviors in the past, and we've all kind of dealt with this, when you're trying to lose weight, this can derail you pretty quickly, and you can get into a situation where you can feel bad about what's happening, and it takes you out of control. So it's important to learn from these triggering events and to limit them and figure out ways to avoid these high salty events. Okay, all right. Some other things that I would like to think about. All right, when you're feeding yourself, pretend you're almost conducting a symphony. Okay, a symphony, right? When you're dealing with your taste buds, it's important the order of the way that you give food to yourself so that you can get the most pleasure out of them. And so think about a symphony orchestra. Oftentimes when you first start hearing a song, it might sort of start off slow. It might start off sort of soothing, and then it kind of works itself up, the rhythm and the different sound qualities and different things. And at the end, you have the finale, the really intense music. Okay. So in the same way, when you're having a meal that might include some salad, or it might include some basic carb that is like, it's flavorful, but it's not super, super saucy or salty or something. Think about the meal almost like a wine tasting, where in this wine tasting, what they do is put the wines with the most sort of bland or mild flavors in the beginning, so that you taste them in succession, so that you can enjoy the flavor of each one. I'm not suggesting that people drink alcohol. Alcohol is bad for you. This is just an example for easy understanding. So with foods, you want to have the foods like the salads and things that are more simple in the beginning of the meal, and so that you can appreciate them. Because if you eat the food that's really saucy and really a powerful flavor, you're not going to appreciate it. It's not to say the worst first, because salad is not the worst, but if it has a bitter flavor or something, you may want to put it in the beginning of the meal so that you can finish that and enjoy it. And then you get more and more of a strong, flavorful taste as you move on, almost like a wine tasting. Okay. All right. There we go. We're back. And I wanted to say hi to Richard Hubbard. How's it going? All right. Please let me know if you have any questions. I can try to answer them for you to the best of my knowledge. I did have some other announcements. In the news, the recipe blog Epicurious has made a statement that they are no longer going to provide recipes on their blog that relate to red meat. So this is a vegan announcement, another vegan milestone. So this is really neat. One more thing to showing that the future is vegan. The future is vegan and plant-based, whether it's related to the environment, which is what Epicurious had mentioned, or for health, or for preventing pandemics, and that sort of thing. Okay, in other announcements, 45 is the new 50. Just came out last week in JAMA that for colon cancer screening, it used to be 50 years old was the baseline time for you to get colon cancer screening, or 10 years before a first-degree family member had developed colon cancer. In this scenario, you would wait till 50. You could do the colonoscopy, or you could do something called the Cologuard, which is fecal DNA testing, which is a way to avoid having a colonoscopy, or Hemoccult testing. Annual Hemoccult testing, which is stool testing for blood. So, but now they've dropped this down to 45 years old. So that puts me in the I have to get screened. I have to get screened for colon cancer. Okay. If you feel that you like the content from this live event, go ahead. And if you're on YouTube, go ahead and subscribe. If you're on Facebook, go ahead and hit like. And thank you so much for your support and for being out here. If you were to catch this live event after the time, then simply write questions in the comment section and I can get back with you. All right. Recently, I was on the No Meat Athlete podcast. So I wanted to thank Matt there at the No Meat Athlete podcast. Thanks for having the question and answer session with me. That was a good time, and I really appreciate that and your support for vegan primary care. Okay, we have some questions. Okay, what would you say to what that someone could do besides medications for hypertension? Okay, Edna, yes, for hypertension. So when devising a diet to treat blood pressure, the American Heart Association had recommended something called the DASH diet. The DASH diet was a diet that was for the dietary treatment of hypertension. And basically, they found that animal products were problematic. And so they recommended a diet low in salt and low in animal products. So, but when studied, the group that had no animal products had the lowest blood pressure and when they were on the diet. But they thought that, that might be too strong of a recommendation to tell people not to eat animal products. So they kind of watered down their recommendation. But yes, absolutely. If definitely you want to be plant-based, that's the first step. Obviously, this is vegan primary care. Second step is salt. The other thing is if you're really hitting protein and protein powders and other loads on the kidney like that, that's something that I recommend against because that's just extra work for the kidney. So definitely decrease those and you can improve your blood pressure. There are other ways. There's hibiscus tea and other herbal remedies, herbal teas and stuff like that have been known to help with blood pressure as well. Okay, Richard Hubbard has a question. Dr. Greger was talking about iodine. Do we need to supplement? Okay, iodine is 150 micrograms. Good question, Richard. Iodine, the recommendation is for 150 micrograms per day for iodine. Now, when you think about iodine, think about it like we take iron because of hemoglobin in our red blood cells. Hemoglobin has iron in the center of the molecule, and we need iron to help to make hemoglobin. And so iodine is the analogy. It is the element that's in thyroid hormone. And so in order to have healthy thyroid hormones, we need to be sure and getting an adequate amount of iodine. Now, goiter used to be something that was very common, and thyroid deficiencies due to iodine. So they actually iodized salt and put it in the population so that we would get exposed to iodine. Because it's high in sea vegetables, but how many people are eating sea vegetables all the time? So you could make sure that your salt is iodized and you're not getting Himalayan salt, or if your salt is a kosher salt, look to see if it has iodine. Many of the specialty salts do not contain iodine, so just be careful with that. And you can supplement with, I recommend supplementing with whole foods, with sea vegetables, nori and wakame, the seaweed salads, eating these maybe once a week or twice a week, or getting nori chips. They're delicious. And supplementing these 1 to 2 times a week. If you eat vegetable sushi, you're going to have the nori wraps on the sushi. So my family, we go and we have vegan sushi one day a week. It's a fun outing for us. If you feel like you might be deficient in iodine, if you hate seaweed and this kind of thing, you can get a urine test for a random urine iodine test to see if you're in range. And so that's something that you can do to test. Richard, you mentioned that that you don't add extra salt to your diet. I agree. You shouldn't be adding extra salt. If you do add salt to your diet, you could use an iodized salt. There are products, there is products that you can use almost like salt, which is kelp. Kelp is so high in iodine that you have to treat it with respect. Because if you eat a normal serving of kelp, then you can increase your iodine too high. You don't want to get over 500 micrograms. So instead, it's almost like you can use it almost like a salt substitute, kelp type salt. So that is something that you could do instead. Thanks for the question, Richard. Great question. All right, Edna says, my dad's skin tone is very red, and I know he has prescribed meds for it. Okay. I'm not sure if you're mentioning, Edna, in regards to blood pressure, or there's things that cause your skin to be red. There's polycythemia, where you end up having more blood cells, blood doping, where your body is producing too much red blood cells from when you don't get good oxygen at night, from sleep apnea, being overweight, heavy snoring. Your body doesn't get very much oxygen at night, and it will produce more red blood cells. More carrying capacity can make you red. Sometimes people will get, in the vegan community, will get a orange or red, orange or yellow complexion that you can see on the palms and sometimes in the skin. Beta-carotenemia. Have no fear. This is nothing to worry about. This glow, this yellow glow. It's from getting a lot of beta carotene. Now, folks who are interested in those smoothie diets where they will do smoothies with kale and other greens and stuff, green smoothies, kale is loaded with beta carotene, and although it's green, you don't see it. Doesn't look like carrot juice. People who juice carrots will pick up this beta carotene color to their skin, this glow. And people get worried that it's vitamin A overdose. And that's not true. Vitamin A is different than beta carotene. And you can test for vitamin A, and you only get overdose from vitamin A by taking vitamin A pills. You can get elevated beta carotene, but it's not problematic for your system other than cosmetic. Now, if you're taking beta carotene pills, this might be problematic, but if you're drinking it, it should be safe, and your body will not make too much of it. Okay. Okay, Natalie says, is there an office to come in for an appointment? Yes, so I do telemedicine, so I have access to lots of folks throughout the country. But I do have an office that I see folks 1 day a week in Pinellas Park, which is north of St. Pete and south of Clearwater. Oh my gosh, I had to itch my nose. Something has got me. All right, thanks for the question, Natalie. Okay, Ria says, so what's wrong with Himalayan salt? I know we all love our Himalayan salt. The concept is, though, just be checked if there is a label on it, see if it is iodized, because otherwise you're not getting that iodine, or otherwise look out and take in sea vegetables to make sure that you're getting at least some iodine, especially if you've had a history of thyroid problems. So Himalayan salt, there's nothing wrong with it per se. Okay. I'm going down the questions, folks. Bear with me. Here we go. We're going to get this started. Okay, Cindy says, do you take supplements? I do. I take 500 micrograms of B12 and 2,000 international units of D3. I used to take omega-3s, DHA supplement, 250 milligrams, but I no longer take that. I just try to get my omega-3s by eating 1 tablespoon of ground flax in my oatmeal every day. So those are the 3 things that I take. I do kind of pay attention to the iodine, as mentioned before, with the once to twice a week nori or sushi or seaweed salad. Okay, Ria asks, I've noticed restless legs bothered me more when I was plant-based. Is taking B1 the proper approach to assisting the symptoms? One of the things that causes restless leg syndrome is becoming iron deficient. And so especially if you're having a heavy menstrual cycle and you're losing iron, and if you've been anemic in the past, correcting anemia is a way that you can try to treat restless leg syndrome without pills, so to speak. So that is a concern. Possibly you are anemic. Okay, Natalie asks, what about taking Bladder for iodine? So I believe, Natalie, I believe Bladder is a seaweed product. And just off the top of my head, I'm not sure the amount of iodine in Bladder. It probably has it. It probably contains it. I know that Bladder, I believe, was used for its estrogen-like properties. So take a look. If you're watching right now and you know the answer to it, put it in the. There are many seaweed products that contain iodine, and I'm assuming that Bladder also does. I just don't know off the top of my head. Okay. So the ones that are typically the iodine-containing foods typically are the nori, the wakame, and dulse. Those are the edible seaweeds typically used. Kelp being so high that it needs to be used almost in a powdered form, little bits. Okay, we've got Dave Ennis. Dave Ennis says, can you identify some plant-based foods which benefit the prostate? Okay. Well, Dave, that's a good question. There is the supplements, saw palmetto, and these kind of things had popularity in the past. And I don't necessarily recommend against saw palmetto or anything, but I do, of course, recommend the plant-based diet in general. We do know the esteemed Dr. Dean Ornish, who helped to be one of the doctors who showed the reversal with coronary artery disease, did a study with prostate cancer. Tell me about the plant-based diet versus cancer. And so they took patients with slow-growing prostate cancer who did not want to get an extreme procedure, and they actually showed reversal of prostate cancer with the plant-based diet. Now, what you may be talking about, Dave, is a prostate enlargement. And at this time, I haven't seen a study that showed a plant-based intervention that reduced the size of the prostate. And so this is a problem. This is a problem for men. Men have problems with enlarged prostates and going to the bathroom, emptying their bladder. And females, they have the exact opposite problem. As they get older, they can deal with pelvic floor relaxation and problems with incontinence and this sort of thing, stress incontinence from laughing or sneezing. This is kind of a issue on both sides. Men get it bad and women have problems with the same kind of reverse issue. So unfortunately, I don't have a good plant-based recommendation for prostate enlargement. Okay, good question, Dave. Richard Hubbard. I wrote to Planet Oats to suggest adding iodine to their oat milk. Dr. Greger said he was surprised it wasn't in plant-based milks. What are your thoughts on that? Okay. Well, gosh, Richard, that is great. You're doing a service for the vegan community. Yes, I mean, plant-based milks are taking the world by storm, and they might as well be fortified with these types of elemental compounds. You wonder, I mean, you assume there'd be some kind of concern about flavor, but it's such a small amount that you wonder if it would have any effect. I think that's a great idea. And I'm really glad that you're a part of the vegan community. We can all have a lot to learn from you, Richard. Richard has a website and Healthy Connecticut. Please, Richard, put your the website in the comments for the rest of the folks on the live today. That is awesome. Very impressed. Okay. Okay, so we have a comment here from Nikki Van Valkenburg. Dr. Scott Harrington, can you recommend foods to increase testosterone? I had my level checked and my testosterone levels are low. Okay. All right, Nikki. One of the concerns that folks have when they're studying their hormones is they start to, sometimes you can get seen by doctors who are real focused on the hormones. And they may be called anti-aging doctors or this kind of thing. And I'm not here to throw shade at the other doctors. But what I can talk about is problematic aspects of hormone therapy. In one of the sort of overall arching theories with the plant-based diet is the idea of trying to get your medicine and all your vitamins and minerals from whole foods, get it from your diet, as opposed to a reductionist theory of getting supplements and taking, because there's lots of compounds and you take this and you take that and you take this and you take that. That is just kind of an overarching theory. And with the hormones, it's in a very similar way that man has a hard time, man or woman or scientist in general, has a hard time getting it right, trying to beat sort of nature's natural pathways. Because when you give someone a hormone, then the body senses that it's getting it from somewhere else and they stop producing it, or there's a feedback mechanism. You can't just change one thing. So, I try to avoid hormone replacements as far as I can in general. If someone's already on these hormones, I'll work with folks to try to manage them as best we can. But in general, I try not to initiate hormonal therapy for fear that we're never going to get it right, just perfect. And so if you've had testosterone testing, there might be a concern that low testosterone could have effects potentially with energy or libido, this kind of thing. And the best thing I believe for energy and libido is managing your diet really well and getting active and this kind of thing. So in a way, I try to sort of sidestep that in a way by talking about healthy lifestyle, sleep, getting out in nature, being that sort of thing. Believe it or not, when men go on a plant-based diet, oftentimes their testosterone goes up. And you saw that in Game Changers, the movie Game Changers. There was, when they had measured erections in Game Changers, it was kind of the kind of one of the surprises of the Game Changers. That's why we show it to men, to try to get them excited about their virility. But when you go on a plant-based diet with men and you decrease fat intake and you decrease alcohol and you stop poisoning the testes, your testosterone actually will go up. But I'm not sure how this works in females, and because I have never heard it explained that way. Sometimes if testosterone is too high, it can be problematic, but I doubt that's the scenario in the female population. So I hope that answers your question, Nikki. I hope I try to approach it from multiple ways. Good question. Very good question. Okay. All right. Richard Hubbard says, I do have the healthy glow. All right. All right. Good stuff. Okay. All right. Deanne Yanez says, I am low in vitamin D and I was told I need to take 12,000 each day. What can I take or eat? Okay. Folks who are really low in vitamin D, say under 10, are sometimes put on really high doses of vitamin D, 50,000 units a week for a certain amount of time until they come out of the deficiency stage and they're up, into a more moderate range. And then to prevent going into deficiency, to take 2,000 international units of vitamin D per day. So if you're on these high doses of vitamin D, you've probably been tested and found that you were very low. So it's important. It's important for calcium metabolism and absorption. And we only get it from the sun, and we tend to cover up when we're outside to prevent sun damage. And so vitamin D is a vital supplement to take. All right. All right. Miyoshi Hicks says, is burning in the right upper quadrant an indication of gallbladder issues or GI issues? So yeah, your right upper quadrant is where your liver and gallbladder are. And if you're having pain after meals or with meals that include any kind of fats, and most meals contain at least some, and you have pain in the right upper quadrant, that's concerning for the gallbladder as it squeezes down, that you might be catching on a stone and causing pain and backup. And so if you're having this intermittent pain and it's happening related to meals, then the way they work that up is with an ultrasound to try to see if you have gallstones. So that's definitely, Miyoshi, that's what I would talk to your doctor about, getting that evaluated. Okay, Ria. All right. Have you had severe iron deficiencies in the past? Okay. All right. Which can cause restless leg syndrome. Okay. Okay, Deanne Yanez, I'd rather eat food. I don't like taking a lot of pills. Okay, so the unfortunate thing, there's not a lot of, you might be talking about the vitamin D. How do I get the vitamin D from my pills? Some people have trouble swallowing pills and that sort of thing. So there may be some other, if other folks are on, maybe you can put in a comment about whether there's forms of vitamin D that are easier to swallow, or sprays or that kind of thing. I'm with you. Deanne, I don't like taking a lot of pills if I don't have to. Sometimes people like gummies where they chew them instead of swallowing. All right. Natalie says, this has been very informational. Thank you. Thank you, Natalie. All right. Healthy Living Connecticut, Richard Hubbard. Thank you for putting on that. There's the link. Definitely. Thank you. Thank you. You are an inspiration for us, Richard. I really appreciate it. Thanks for being here. If anybody has any kind of questions about weight loss journey, about plant-based health, Richard Hubbard is a great resource, and he's invited me on his podcast before, and I have nothing but respect. Thank you so much for being here today, Richard. Thanks for your time. Okay, what's the best way to heal chronic fatigue syndrome? Chronic fatigue syndrome is a tough one, and it's I have good luck with getting people on a plant-based diet. If they're not plant-based already, you can have improvements. If you're already plant-based and you're having trouble with chronic fatigue syndrome, this one is very tough. I know a lot of people don't like to hear the idea of, depression in relation to this, but it can be very, fatigue can be very hard, and it can be sometimes depressing. So I do manage the depression as well. And I try to get people to doing whatever exercise they can tolerate, even if it's just walking and being in nature. I know that sounds like simple recommendations. We could look for basic nutritional deficiencies and that sort of thing. But mainly the important thing, but when you have chronic fatigue syndrome, you need to have an advocate. You need to have someone who's going to listen to your complaints, listen to what's going on, and trying to take things one step at a time. And so it can be hard. It can be hard when you're feeling rushed and you have all these medical problems going on. And so I think, a team approach and having a physician who's willing to listen to what's going on is probably one of the best sort of treatments for chronic fatigue syndrome. I hope that helps, Tanya. That's how I manage it. Miyoshi says, thank you very much. Thank you, Miyoshi. Okay, Mark Liebman. Do I need to take vitamins? I'm a longtime vegan and healthy and don't take supplements. Okay, all right. I know the vegan diet has so many wonderful things that come from it. But I was cavalier too. I was cavalier and initially didn't take B12. And I'm a doctor, but I was wrong. I was wrong, Mark. My B12 was low. And some of the problems with B12 being low is it's involved in the nerve sheath. So the myelin sheaths of the nerves, it's involved with lots of processes. But if you don't take it, you can be low and then you can have irreversible changes. So it is very important. It's important for omnivores to take it as well. So at least take a B12 supplement. I recommend 500 micrograms daily or 1,000 if you're over 50. And so don't be cavalier about this one. Don't be cavalier. Just take it. Being water soluble, it's unlikely that you could take too much. So it's definitely an important supplement to take. I'm not a big supplement person. I don't own stock in supplements. I don't prescribe. I don't produce my own supplement. And so I have no reason to tell you otherwise other than for health. So that's what I recommend, Mark. Taking vitamin D is a good thing too, but B12 is the most important. All right, Cindy, thank you. All right, thanks again, Cindy. All right, Cindy says, well, what's the I haven't got an annual checkup. What's the advantage of seeing you versus seeing a regular doctor? Well, it's nice to have a doctor in person who's local. And then I can be seen, once again, I can be seen as a primary care doctor, sort of someone who can see you and get to know you. Or I could be seen as a one-time consult if you have, specific questions and you want me to review your medical chart and this sort of thing. I get all of my patients set up with a chart, and they have access to see everything that we discuss and can add labs and that sort of thing. I can order labs, order referrals. And so the main advantage that people tell me is that they just like having a plant-based doctor who's in the same as understanding, like the birds of a feather, because sometimes you may get a provider who kind of blames your medical problems on being plant-based if they don't understand. One day, all doctors will be vegan because it's the most evidence-based way to eat. It has so many medical benefits that it's going to be like smoking. It's going to be like smoking was 20 years ago. You don't see too many doctors smoking today. So one day there'll be a need for vegan primary care because all the doctors will be vegan. But until then, if you'd like to, you can come see me. You can just go to my website, veganprimarycare.com, go to book an appointment, and then you can do it virtually. Or if you're locally near Pinellas Park, you could be see me on Fridays. Okay, I think we've got through all the questions today, and I want to say thank you to everyone's participation today. It was great. It was a great session. Thanks again for everybody.